Welcome to Deconversations, a rather excellent podcast if you're listening, and a webinar if you're watching, discussing all things related to medical devices decontamination. Brought to you by Dan Cole, the instrument maker, Matthew Pescott, entrepreneur and former sterile services manager, and Pavel Di Sternberg-Stylovsky, a research and development engineer.
Welcome to the second episode of Deconversations. Delighted to have Melissa Merry joining us. Melissa is Decontamination Manager at Portsmouth NHS Trust, and Melissa's been involved in healthcare for over 30 years. Would that be fair to say?
Yep, that's fair to say.
Okay, good. And sterile services point of view and decontamination point of view from 2004. In a variety of positions, in deputy manager and managerial positions, the Royal Free for over 3 years, HCA in the private sector for over 6.5 years, and then a year at Kingston and then to Portsmouth. So really have had a wealth of experience at different sites, and also interesting, you've had both the public and private sector experiences as well. We've got some questions for you, and this episode we want to focus on COVID and really how that impacts your profession and your department and what your experiences are so far. Today on this episode we want to talk about COVID and the effects on decontamination, and really talking about the return to elective surgeries. We were just briefly discussing it, that from the statistics I've seen, there's been over 550,000 cancelled cases that in the UK that have got to be obviously reaccounted for and prioritised. So going to go through a few questions that we've put together. The first one of those is: are there specific precautions that you've had to put in place around COVID in your department with a view to return to elective surgery?
Well, we've had changes that have affected us all the way through. So when this first hit, our electives went down to almost nothing. Portsmouth did take the decision to continue on with cancer treatment and cancer diagnostic procedures, but all other elective surgeries were taken out. Trauma was still done. We do have maternity, so we still had babies being born and things like that going on, but our activity went way down. So we had to take the decision the decision that I took anyway was to bring our staff into the days. We ran a 24-hour service, but we brought everybody into days because we were expecting to have to redeploy masses of our team to other areas to help support critical care. So we did redeploy some of our staff to theaters to help with doffing and donning. We redeployed a couple people to pharmacy who helped just with logistics of deliveries and moving stock and sorting everything out. And they're still working in those areas now. And then we just focused on doing training and trying to clean up some, like a backlog of paperwork and other things like that. But now that we're looking to get back to things, we have decided to go back to our regular running hours from next week. But that's more because of the social distancing issue. I have about 80 staff here, and whilst we can kind of space people out in the production areas, the big problems we have is the break room and the changing rooms. So we have to stagger when people have access and stagger how many can go into the break room at any given time. So, and that's going to continue, I think, while we're still getting back to whatever normal is going to be now. Theaters are starting to do more work. Some of our external customers who had stopped working over the last what's it been, 12 weeks or so, are now starting to possibly do a bit more work. So we're looking to pick up our production, but we just don't know how much it's going to change at the moment. So it's just trying to ease our way back into it and keep the social distancing in the meantime.
I mean, that is a real challenge I guess in all workplaces. I suppose from the clean room perspective, they're used to wearing elements of PPE, perhaps not as extreme But how, guys, have you got any, just leading on from Melissa's comments there, is there anything that you could add? I think obviously, Matthew, you have experience in PPE and supply of that to the sterile services departments. Can you see if there's any sort of impact there? And I'm thinking around how it would affect workflow and obviously being able to really meet the demand.
Basically, I have a lot of sympathy for all types of departments, especially trying to get back to some sort of normality with still implementing sort of social distancing. I mean, the thing is, the guidance is a bit woolly about wearing masks, especially. So, I mean, Melissa, is there any intention for the staff to be wearing masks in close proximity to each other?
No, not as such. I mean, we prefer they keep their distance. If we are looking to have people working closer together in the future, maybe, I don't know. The only recommendation I made to the team when we first were dealing with this was in the washroom. They didn't need to change their PPE overall. We wear, we follow standard precautions. We're treating everything as highly infectious. So I didn't really see the need for us to change anything, but I did recommend that they do wear a mask when they were handling equipment in the washroom in particular, because once the equipment's gone through detergent and water, it should be okay. It should be relatively safe, but we didn't want to take any chances, and so it's like, okay, guys, if you're going to collect, if you're washing, wear a mask. But also wear your visor, wear your hat, wear your gloves, wear all the things that you normally wear. And we did have problems, as a lot of hospitals had, with supply, so we were used to having a regular supply of the things we needed. And then all of a sudden there was so much pressure from other areas needing to use gowns and masks and everything else that we were having to possibly struggle to make sure we had enough. But because the workload was down as well, I would tell the team, look, if you're in the production area, even in the clean room, you don't necessarily have to have on full PPE if you're not reprocessing equipment. If you're just sitting there because you're waiting for work to come in, then don't waste the PPE. Wear it when you need to. So, and they've been really good about it. They definitely err on the side of, oh, we're going to wear it. So that's no bad thing. But, we just needed to make sure they had plenty.
So, I mean, from the sort of self-isolating perspective, or the distancing perspective, are you looking to put in sort of markers on the floors and sort of one-way systems so they don't have to keep passing each other in corridors and things?
The way that our department's laid out, I think it would be really difficult to do that. I hadn't really thought about one-way systems. Our hallways are large enough that generally they can walk past each other. What I've had to kind of keep an eye on mostly is keep them from gathering. So it's like, okay, guys, spread out. You can talk to each other, but just spread out, The break room, we have put like tape on some of the chairs so that it's like, only 6 people can go in there and they have to space themselves out. So we've, kind of made that a bit clearer as to where they need to sit. But I think overall they have been really good about, distancing. The other thing that we introduced that we do every day as well is we do temperature checks on everybody every day. So if we had any concerns about anybody, we would deal with that as quickly as we could. But they've just been really good, and they come and they're like, oh, I want my temperature check, make sure I'm okay for today, and they've been doing great.
Right. Okay.
That's really good to hear. The sort of proactive and enthusiastic from staff, and I think it's for everyone's welfare, isn't it? And you've also got you've got the patients to consider from the point of view of reprocessing the instruments, but also there's another factor now as well, isn't there? And that's obviously potentially passing on a virus. But Pavel had a good question which I'll relay, and this is that just around the virus and how it survives on stainless steel surfaces, and if there's any special measures for internal logistics within the hospital, so things like trolleys that may be moved in and out of contaminated areas. Was that the gist of it, Pavel?
Yes, certainly. One thing I wanted to understand is whether there are any systems in place and whether the infection control teams are also putting specific guidelines for how this is treated, whether there are specific precautions, because as Dan mentioned, we know that the virus survives on stainless steel for a long time, whether there is something specific done around that.
Yeah, well, we've been using the Clinell green disinfectant wipes for, we were using that on stainless steel before COVID came along. And it was interesting because I had a discussion with my infection control lead, and she said, "Oh, you're not supposed to be using that in this trust." And I was like, "Well, we are." And then within a few weeks, I had an update from her saying, "Oh, we've had it approved now. It's actually effective against COVID." So we've been using it and wiping down stainless steel surfaces. We've been using it in our office every day to wipe down keyboards and mice and light switches and door handles. And, the contact time, I believe, is 1 minute. So, we've just been kind of trying to make sure we get everything well coated so that the drying time is within the contact time. We do have a trolley washer as well. It's not disinfecting, but it is something that we do put equipment through. But the team are regularly wiping down everything, tables, trolleys, it's all being dealt with. And Clinell wipes have become, the green wipes have been, they're everywhere. Now, I do know there is possible issues with residual. I don't know. I think there were some concerns about that before, but I think that the desire to rid ourselves of any COVID risk has overridden any other concerns with regard to that at the moment. I'd like to think that when things do go back to whatever normal is, we will still use the Clinell wipes, but not to the extent that we have.
And to what extent is the internal infection control team involved in sort of helping you out with making decisions on things like that?
Well, we run anything past them that we're dealing with. The other thing that we are using for different applications is Actichlor Plus. So we're doing, because that's something that's been recommended for the trust as well to use for disinfecting some things. But, I've got a really good relationship with the infection control lead. And in fact, I think COVID has helped us develop a stronger bond because I've only been at Portsmouth since January.
No, that's great to hear that.
Yeah. So
it's a collaborative spirit in terms of solving problems.
Yeah.
Looking into it together. So that's fun.
Yeah, I mean, we've had to address a number of issues. We've had theaters and other clinical areas asking us about various masks and goggles and hoods and all kinds of things. So we've had to work together on reviewing those kind of items to see what we could either agree could be used on a limited basis and with risk assessment and everything else. So yeah, we've got that communication with them, and I know if I have any concerns about anything, I can get a hold of them immediately, and we can review what we need to do. And thankfully, everything's been pretty good. It just seems like everything's gone as well as we could have hoped. We didn't have the number of patients that we were anticipating. Nobody knew what it was going to be like. In the early days were very scary. We were sitting in these meetings every day. And also Portsmouth has quite a strong military presence. So we had our military colleagues that we were working with. And, it just kind of felt very eerie. And we were all like, oh, God, what is going to happen here? So I think we were all relieved when it didn't happen the way that we were anticipating. But, we still don't know that we're out of the woods yet.
Yeah.
I think just to echo what you said there, Melissa, and obviously I'm not in a healthcare setting, but we're a medical device company, and I remember the surreal situation of addressing staff about the issue and what may be likely to happen in coming weeks, and just having that sort of feeling that you've got like you're the third person watching yourself delivering this bizarre, and very scary and worrying. Obviously, from your perspective, that must have been hugely stressful. But great that the staff have been so positive to then react in the way they have and be proactive. Just to sort of call moderator's privilege, I had a question myself that I wanted to add in, which shouldn't try a spanner in the works too much. So, sorry, that our noise is back. One thing that struck me after I read the guidance from the BOA, the British Orthopaedic Association, on how they're how surgery will start up again, and I was amazed at the precautions. So, firstly, the testing before and after of the patients, how they're going to be tested, but also obviously, for want of a better term, onerous level of PPE that will be needed in surgery and everything like that. So obviously, is it going to put an extra emphasis on decontamination of the devices? Are they obviously, because the decontamination of the surgical area is obviously heightened so much? Is there going to be extra scrutiny on that? And it is, because obviously I was just thinking of availability of instrumentation as well. And if people start to worry about COVID as such, then is that going to lead to extra scrutiny on the instrument side of things?
I don't know. I'd like to think that it will just make them more aware of the importance of it. We always struggle with theaters and clinical staff just thinking, that the equipment comes up to us and we just have magic wands and we magically tap it and it all becomes clean and easy for them to use again. So I think they will be more aware of, it's not that straightforward. It's not that simple. And they, I think, will just be hopefully a bit more appreciative of that, but that might just be me being really optimistic. I think that, a lot more is going to impact on how they're doing things with probably other equipment that's used in the theater, whether that's a stack or their smoke evacuators or other things that they're using that, they might have to be a bit more aware now of how that stuff gets used and how things are cleaned and how they're checked than before. I know the doffing and donning process is, in and of itself has been a real eye opener for them to have to go through this very formal way of removing PPE and actually going and showering and then coming and changing and how they dispose of everything and how they deal with it all. It's just been really interesting to see them go through that.
Yeah, I bet. I mean, I was just thinking from the perspective of that sometimes obviously instruments can be cleaned and they can be visually clean, but not necessarily clean. And obviously with things like protein, that's another factor. But just obviously if you don't not understand the science behind how the viruses may be killed, someone saying, how do we prove that this device is COVID free? But I suppose that would come down to your validation of your cleaning equipment, wouldn't it? And that obviously proving that would kill certain viruses and bacteria.
Yeah, well, I mean, the initial advice we were given through PHE and through our infection control, and that was that soap and water kills it. Detergent and water kills it. Alcohol gel is important. Washing your hands is important. I'm not aware of any other risks that have come through with that, but I do think, it is just important that we make sure that things are cleaned. And I've been really pleased that during this time, I thought we were going to have a problem with getting our equipment validated, that the companies that supplied our engineers weren't going to be available because of social distancing and all this other stuff. But we've had all of our machines, they've had all their quarterlies, they're all up to date. And, that's very reassuring because then we're not having to worry. Our machines are functioning, everything's going as we would expect. So that just gives us that extra measure of confidence in what we're doing.
Yeah.
But I have a question sort of piggybacking on what we've been discussing at the moment. Do you think that the the whole situation with COVID is going to put more emphasis on the general infection control practices and sort of elevating the status and the importance of making sure that the infection control as well as decontamination departments get proper support and they can actually deliver. Is there going to be a more awareness in general in hospitals about the criticality of the role of those elements?
Yeah, it's hard to say, isn't it? In my ideal world, yes, people would be more aware of it, and they would be, even thoughtful about, oh, I need to wash my hands. I need to make sure that I'm not, the 5 points of, when you wash your hands and when you're dealing with people and that. I don't know. I don't know if this has been significant enough to make that kind of impression on people long term or not. I certainly think it will impact on people. I think, well, a number of the people that I've either worked with who are currently home shielding or other people who are vulnerable, they're terrified. They're still very scared. For those of us who have maintained our health and are able to go out and interact and do the things we needed to do without too much, there's been obviously major compromises in travel and other things like that, depending on who you are. But it just seems like, okay, it hasn't really made that big of an impact. It's kind of hard to really gauge what the difference is.
Yeah.
From my perspective, I had a couple of conversations yesterday with colleagues from Switzerland and United States, and the general consensus was that everyone was hoping that there's going to be a little bit more emphasis on showing people that there is something happening in every hospital. There are teams of people who are working to make sure that we limit the possibilities, the risk of infections in general. So I'm also hopeful that this is going to make a change.
Oh yeah, definitely. I mean, and I do think these things always put our executives and our senior management in a challenge, and I think that Portsmouth have responded incredibly to everything that's happened. Our community has been extremely supportive of us as well. We've had to limit who comes into the hospital. We've had to take measures on how people can be tested, how they can bring in things for their families or loved ones who are in the hospital, and who's allowed to have access. It's had to be severely restricted. And I do think that people will be quite, I'm trying to think of the right word, but they'll work with it because they understand that it is important and that we want to make sure that we're not putting them at any unnecessary risk. So going forward, we won't have everybody coming into the hospital like we did before. And it does seem weird, like before, in the months before COVID came along, we were really struggling. Our A&E was oversubscribed, and it was a real challenge to the hospital. Of course, beds as usual with the usual flu season and all the other things that happen. And, it all changed so dramatically. And then it's like, okay, well, will it go back to before, or has it changed the mindset of people generally about when they go to the hospital and how they go to the hospital? And of course, we know there's the likelihood that we have a lot of people who aren't being referred for cancers at the moment. So whilst we've continued on and done diagnostic and therapeutic treatment, there are a lot of people who haven't even talked to their GP or seen their GP to be referred. So we will expect an increase, and there'll be pressure with that. Definitely.
Yeah, I think you from public going back into the hospitals, you really want to make sure that they're comfortable, because so they can be encouraged to come back in, don't you? Because as you said, you've got A&E was oversubscribed, but now people who probably should go to hospital are concerned. So you really got to show that almost over the top that people that the procedures were in place, that obviously the relevant steps have been taken. Having visited a supermarket a couple of days ago and been shocked at how relaxed the staff around there were, and I won't name the supermarket, but you know, in terms of like, you know, no PPE at all, and you've got this, you know, these way system, but not being followed. You just think, well, that doesn't give you reassurance. For me, it's like I'd go back there, but would I want my wife going back there to put herself at risk? I think you've got to be upfront, haven't you, and secure people's concerns.
Oh yeah, definitely. Yeah, I mean, and I've been amazed too how few people cough in public now.
Yeah.
Yeah, you
Yeah.
know, you're used to like cold and flu season and people sneezing and coughing, and you know, and I lived in London until January this year, so I was used to public transport and you know everybody sneezing, coughing, and carrying on. So I've always been a bit. I've always taken my own precautions to avoid that anyway. So I think I'm a bit more aware of it than maybe a lot of people have been. But yeah, I think overall, when you see people, you know, at least being mindful of it, it helps. But it is like, when are we going to be allowed to enjoy ourselves again, you know, and see, I mean, I know for people, you know, with children, grandchildren, they want to be able to go and see their kids and give them a hug. And
You were
do
just saying, obviously, it'd be nice for people, you know, grandparents to see grandchildren, and I'd like to add, as a parent, for us to be able to palm off the children on the grandparents. That is, you know, that would be that would be good.
Oh yeah, definitely.
I think we had one more question that came up that we probably that we haven't really covered, and that was around the bottlenecks in the process. So when the demand for instrumentations kick back in, what are there potential bottlenecks that you're aware of? I mean, just to add to that, I was on a podcast yesterday with a colleague whose family are involved in hospitality, and they've got, you know, they've opened up the shutters for the first time in 3 months and firing up everything. And it turns out that a lot of equipment doesn't like being turned off for 3 months. You know, they've got leaks in certain things and certain machines aren't working. So is that something that, just building into the bottleneck scenario, is that something you've had to address ongoing? I know you mentioned the validation, but are there certain concerns there that could cause issues?
Well, I think our main concern is, and again, like a lot of hospitals, our equipment is of a certain age, and we are looking at trying to get replacements and get things upgraded. And so our equipment's on the older side, and we haven't been under the pressure that we are normally under. So we haven't had probably the number of breakdowns or the number of issues. We did have the validation, so you know, at least we feel confident that the equipment is functioning. We have been using it. In fact, our production, while it went down dramatically, our production is still quite high, you know, compared to other hospitals that I've worked in with smaller units. We're certainly working at a normal pace for a smaller unit, but for the volume we would expect, you know, we were probably down to about a quarter of what we would normally do. So as we get back up to that volume of work, I want to make sure the machines are going to be functioning for us. I'm not really too concerned about our staffing. We've gone back to our regular hours. So I think, you know, once we start getting the volumes of work in again, we're going to be able to handle that. But I'm just checking my notes to make sure. I mean, we did have some problems during when we reduced our hours. Theaters were really keen to get any COVID or COVID at risk equipment out of the theater as quickly as possible. And we had a few days during the week where we didn't have a night shift on. So they were worried about the equipment being left in the hatch. So we just made arrangements for trolleys to be left down there for them so they could put everything in the trolley. And then at least first thing in the morning when our team came in, we'd collect it. So, you know, we try and be as adaptable as we can with whatever the situation is. But I do think we're at least in a very good position. I'm not too concerned about getting back up to that level of work. It's just going to be a matter of when that's actually going to happen, because I think it's going to be a bit slow. And then it might be that everybody throws caution to the wind and we get back to normal, or we have a second wave. we just, whatever's going to happen, we're going to have to adapt with it. But, that's healthcare.
When you're coming back to the high volume of surgical procedures, obviously at the moment you've got those additional sort of social distancing rules, additional PPE, additional infection control in terms of preparing surfaces, cleaning trolleys, and so on. Do you think that this is going to perhaps hinder your effectiveness, or put another problems in the pipeline of having the sort of efficiency that you used to have before COVID?
I don't think it'll hinder our progress or our efficiency at all. I think if anything, it's helped instill in technicians, maybe refreshed for them, the need to have good practices. Clean your tables down, make sure your environment is kept as clean as you can. And when you are overwhelmed, some of your practices might get a bit sloppy or whatever, but I do think if they get used to it, then it becomes more of, we want good habits. We want them to, understand that, yeah, I shouldn't just be doing this because it's a particular infection or a particular concern. This is what I should be doing every day. Mm-hmm. And so I would hope to see that it'll just become part of what they normally do. And, they might relax up on, okay, I'm not going to wear a mask all the time, but they might be more aware of that and just think, yeah, no, I would prefer to wear a mask. And I don't think that's a bad thing.
No, that's it's fantastic, to be honest, because this is something that I know, for example, how much we've been impacted by the new rules, sourcing materials, and so on. And it's great to hear that, especially from the infection control point of view, the staff is really keen to go the extra mile and also adhere to the new rules and make them a habit, because this is excellent.
Yeah. Well, and
I have to wait for COVID to happen for that to be implemented, but there we go.
Yeah. Well, I just wanted to say as well, I mean, my team have been so brilliant, and I don't, you guys probably saw the thing I put in LinkedIn. They decorated the department for VE Day. They had all these various drawings that children, family members of staff did, and we put them up on the walls. We laminated them, we put them up, and we just wanted to try and make the place as cheery as possible. And also the first time I met with them, to discuss our changes and everything. It was the first Thursday they did the clapping, and I met with the day shift during the day, and then I stayed on into the evening to meet with my team that work twilights and nights to talk to them about things. And we happened to have our meeting at 8 o'clock. So we started the meeting at 8 o'clock, and I said, right now across the country, all these people are outside clapping and we can't hear them. So why don't we clap for ourselves? So I had, staff all the way down one hall, all the way down another hallway so that we could do the social distancing. And I was having to yell and project so that they could hear me. But, I said, okay, let's start with that, and then we went through everything. But their attitudes were so brilliant. Everybody was, they were scared, they were concerned, but they were like, okay, we're here to do our job and let's just get on with it. And, that's just been awesome. You don't want any more than that, really.
No, that's wonderful to hear. And has obviously, the 10th and final clap last night, has on a weekly basis, is it something that you've seen in the hospital that's, that is a boost for morale? Because obviously, it's a gesture that we can do as the public, but obviously just to show the appreciation for what you guys and healthcare staff are doing.
Yeah, well, I mean, it's nice. I think that, we all deserve a clap. I don't think it matters where you're working, whether you're in healthcare, whether you're a garbage man or a postman or somebody who's working for one of the utility companies, any key worker who's out there, but also for the people who are staying home, that's got to be harder, and the thing that I reminded my guys sometimes is, look, you're working, you're able to come to work, you're getting paid, a lot of people don't have that at the moment. So let's keep things in perspective and stay positive, for everybody, because it's very difficult for people out there. So yeah, I think it's nice that everybody's clapping, but I think that it's also we're all frustrated by, when do we know it's safe to live our lives again? And I just think, let's all clap ourselves every day and be thankful for, we're getting through another one, and it's nice. But our hospital's been very good too, and obviously the public have been extremely supportive. We've had pizzas brought in and curries brought in and all kinds of things, and our department hasn't been forgotten in that. We have boost boxes. They bring us up boxes full of just all kinds of random treats. And those can be, food, of course, but things like hand lotion and hair products and things like that, which is really nice. And so I think it has been nice for everybody to feel like they've been appreciated. But, we're kind of like, yeah, but this is what we're here to do. And so, yeah, a little extra appreciation's nice, but we're still here to do our job.
No, that's great. Sorry, Matthew, go.
No. All I was going to say is that one of my concerns is that because the NHS and healthcare workers are being made to feel so special at the moment, when this is over, human nature says that we'll all go back into our old habits of not appreciating the NHS and the staff not being appreciated like they are at the moment. I mean, is that a concern that when we get back to normality that they will feel sort of as they did before, the Cinderella service?
I don't know. I'm not on my end. I'm going to try and do everything I can to keep our team's morale up. I've come into a department that's done a lot of work on training. We've had people who've done the apprenticeships and technical certificates, and we're really proud of what our team has achieved, and I just want us to keep going from strength to strength. And I know that our chief exec and our senior team are aware of our department. Our division leads are aware of us and supportive of everything we're doing. So I'm just hoping we will continue to have moments where we celebrate ourselves, which is the way I've always tried to run the departments I work in anyway. We've got to make sure that we're recognizing the hard work that we do. The public don't think about us. They don't think about sterile services when they hear about the NHS. They think about doctors and nurses and, other people who are visible to them, and we're invisible. But, we're back here, and I don't mind being invisible. I just like that I'm doing my job and that my team are doing our job. So we get a great deal of satisfaction out of that.
Yeah, I think that's, that's why it's important to do things like that. And that's why Deconversations came around, because we wanted to get, some voice out in the UK for people that we really feel were, unsung heroes in the healthcare sector. So, really appreciate you answering those questions brilliantly. A great insight into life inside your hospital.
No, that's fine. It's been fun.
It's been fantastic, because it's it's always great to get someone who is really doing it in the midst of things, and seeing how much extra work is also carried with those departments that are supporting the sort of healthy operation of a hospital. And yeah, it's been fantastic. So thank you very much for that.
Thank you.
I've got one final question, which I think could be good for Melissa and Matthew, both with the experience and background you've got. And this is something that we could perhaps cut together at the end. But on the basis of your background and the different hospitals and roles you've worked in, what would you say, and Matthew, you can obviously chip into this as well with your experience, are the key attributes to a really, really efficient and well thought of sterile services team member?
Melissa, you go first.
Okay. Well, I think what's most important is to develop people and get them to have good habits You know, that they know when they go into whichever production area they're working in, they know what they need to do. They go in and they start, you know, I wipe my table down, I check what I need to do, I communicate with my team, and we make sure that we're getting things prioritized and getting things moved through. And the more competent that staff are, you know, the stronger that they feel that they understand what they're doing and why they're doing it, the better they're going to do it. And that all feeds into making stronger teams, better production, fewer errors, and just generally a good workforce. And then also, if you do have problems, you can pick up on them so much more quickly. You can identify where they're coming from. And again, try and support people. Get them to understand, you know, this isn't about blame. It's about making sure you're doing your job properly. And what can we do to help you do that? So I think that you know, when you have a challenge like this, it helps bring those things into focus. And I think we've had a real luxury by not being as busy, because we've really been able to pull things back and look at what are we doing? How are we doing it? So as we get busier again, I'd like to see that that has a positive impact on things, and that we don't let that go, that we keep that momentum growing and continue to improve our service and our team with that. So, you know, again, I'm the eternal optimist. I always want to see the good out of something. So I'm going to try my best to keep that going within the department.
It's great. Matthew, anything to add there?
Well, yeah, pretty much agree with everything Melissa has just said. I mean, the only from my experience in sterile services, I did find that if you make them feel sort of involved, instead of, you know, telling them to do something, explain why they're doing it, but also ask their opinion. You know, because the thing is with SSD staff is often they might have a better idea of how to do something. I think the IDSC should be about the staff. It should be about the promoting the training of staff, but done in an NHS sort of environment. So, but anyway, that's my take on it. It'd be interesting what Melissa thinks.
Well, I you know, anybody who knows me and who has seen me at NHS or at the IDSC conferences over the last, I don't know how many years, knows that training is one of the big issues. I've always had a real passion to try and make sure that staff are trained, and a real frustration in how difficult it's been to make that training available financially, and to make it valuable to the people who are being trained, that they're actually going to be able to move into better jobs as they develop. And, you know, we have a lot of, we're going to have a lot of progression to do, and do we have the staff to do it? You know, so that could be a whole other program for sure. But I have been an IDSC member for, you know, gosh, I don't know how many years now, since 2007, I think it was. And I do want to try and be supportive and be a good member and everything, but it's still, I feel like in terms of the departments I work in, I need to focus on how can I improve it, and not necessarily wait for the IDSC to do it for me. You know, and there's just so many complications with it. But it's just unfortunate that we don't have a real clear pathway for developing our staff and making sure they do meet training outcomes and are prepared to take on those more responsible roles as they develop.
Yeah, no, I think that's training is the key, isn't it? And from what you've said, obviously diversity of skills, attention to detail, and that's where I think the educational side of things is so important. You want those people who are aspiring to go up the ladder and be the future of the industry, because they're interested and because there's good quality content delivered at conferences, and that's, you know, quite, you know, frankly, really why it inspired us to do this, because we wanted to get that insight that we perhaps feel maybe missing slightly. We might water down what Matthew said a little bit, but yeah.
Well,
I
did recommend that you might want to cut a few bits out.
Well, fortunately, the wind tunnel turned up when you were speaking again, so that's probably sort of.
Yeah, it's last time. That's very convenient.
It's funny. You've got that on-off switch, haven't you?
Yeah. Oh, Matthew's back.
All right. Well, thank you guys. That's actually excellent. Really enjoyed talking to you all.
Thank you.
And yeah, we'll hopefully follow up and have a second chat at some stage. Melissa, been really interesting. Really appreciated.
You have been listening to Deconversations. Join us soon for new episodes.